Hello, my name is Alicia and I'll be talking about motivation today. Motivation is defined as the reason or reasons one has for acting or behaving in a particular way. It is a general desire or willingness of someone to do something. Through motivation, we can influence people to better themselves, improve organizations, and actually give people hope. As you know from nursing, we have a big impact on our patients. I had a patient one time that felt like it was the end of the world and she was ready to die only because she had chest pain and she was on nitro drip. She had diabetes and hyperlipidemia, arthritis, and she felt like she had everything under the sun. When really she only had to be educated on the disease process and what she really had. She wasn't taking none of her medications and adhering to the regimen that we provide when every time she comes into the hospital. She was a frequent flyer. So through education and motivation, I educated the patient about her different disease processes. She actually listened, consented to actually taking medications like she was supposed to. She was so influenced that she actually wrote a letter to the manager saying how great the floor was and that she was thankful that someone actually took the time out to educate her about things like that. Um, and she hasn't been admitted to the hospital for months now, actually. Also, I read an evidence-based article titled The Influence of Nursing Leadership on Nurse Performance, a Systematic Literature Review. And this article is by Pamela German and Greta Cummings. It is a great article because it informs readers on how nursing leadership can relate to motivation and perception of nurses. Nursing leadership behaviors have been linked to influencing nurses' ability to exceed employers' expectations and in meeting organization goals. Many different concepts fit into the theme of motivation. The different themes discussed are working relationships, access to resources, individual nurse characteristics, leadership practices, and autonomy. All these are discussed in the article, but I'm just going to kind of give a general summary of what the article said. Under the category of autonomy, nurses felt that their work life was enhanced through the leaders that were motivated and that they displayed confidence amongst their employees. Nurses feel the most effective when they're actually able to use their skills and put them to use under their job category. Working relationships are usually trusting relationships between employers and employees and the coworkers. And through this, effective communication happens. But only through effective communication will this happen and trusting relationships will be built. Nurses feel confident with their jobs when they have the necessary resources and are able to use the tools that they are given to perform their job. Nurses also have individual traits that define who they are. And, some people can be defined as lazy, some people can be defined as motivated, and some can be defined as just laissez-faire, it's kind of like whatever. But with our job description that we have, we really need to become motivated because we are the eyes and ears of the patient. We are the advocate, and we must dedicate ourselves to being leaders so that we are able to continue to motivate our patients. Some nurses do not realize how big of an impact we have on patients' lives. Like I said, we have to be motivated to help oftentimes, and if we are motivated to help, they are usually willing to listen and to become more apt to become involved in their care. We must practice being a leader and becoming influential individuals. Motivation depends on the individual and whether or not they are ready and willing to change themselves and lead others. And like I said, for more information, you are able to Google the article titled The Influence of Nursing Leadership to Nurse Performance and Systematic Literature Review by those two authors that I listed earlier. So I hope that you guys make a difference in someone's lives and become motivated and influence someone. We are nurses, we are nurse leaders, we are motivators.